introductory question. We're going to move on to questions from the panelists to each other, but also the opportunity for you, the audience, to ask questions and to also provide comments. So we'll explain more about that and how you can do that further along. So the first question I'm going to ask is if the panelists could introduce themselves and provide a short summary of the projects that they worked on, the anticipation alert, how did it happen and what occurred. So I'm just going to share my screen and I'm going to put that question first to Hussam.
Hello, good morning, everyone. Thanks for the introduction, Ed. So my name is Hussam. I'm the humanitarian analyst, and I just want to go really quickly over the anticipation alert that we did in Sudan. So there was basically two phases. The first was the AA action itself. Floods in Sudan are, like in many countries, an annual risk that we're all very aware of. And so we raised the Alert to Start Fund along with a couple of partners, including Islamic Relief Worldwide. And we did for a community-led anticipatory action project in Sudan based on a 10-day GLOFAS forecast and the historical data we already had, knowing which communities were the most impacted over the past 2 or 3 years by flooding. We reached out to the communities and basically asked them to help design the flood anticipatory action. The image you're seeing here is from those self-same consultations. The actions themselves were not, particularly interesting, but rather it was what the community's requests came in for. They were asked if we wanted to bring in heavy machinery or if they could do it themselves, and they chose to do it themselves through a cash for work scheme. There was some DRR work, there was some livelihoods work, seed distributions, fast maturing seed distributions, so on and so forth. But the fact that the community was involved from the very beginning meant that they were able to identify the best ways to prepare for the upcoming flood. Because in their mind, of course, the floods were inevitable, irrespective of what the meteorological agencies were saying. And we felt that it was a very positive and impactful project. And so the second phase was the impact assessment that we did. This is perhaps one of my favorite images from that assessment. This is the child-centered focus group discussion. And the impact assessment was interesting. So again, we raised a request to start fund for a learning grant. And we went back to these communities because some of the communities we didn't reach in time, right? 10 days is not a lot of lead time, quite frankly. So some of the communities we were not able to access. The rain had come, the flood had washed out some of the roads. And so during the impact assessment, we were actually able to have viable control groups, basically. We were able to compare the impacts of the floods between the communities that had received AA support and those that hadn't. And we were really able to demonstrate that first, that AA had an impact, at least in the eyes of the community. They were incredibly grateful. But we were also able to highlight some of the challenges that we faced and some of the places where we could have done better, which I think is where that report is most valuable. It was also an interesting way for us to close first, obviously, the learning loop, where we were, taking the learnings from the project and making them publicly available, but also the feedback loop with the communities, where after we had done our assessment and done our analysis, we went back to the communities to validate our findings. And interestingly, there were a couple of findings that we weren't confident on, the community confirmed, but there was also a couple that the community basically invalidated for us, right? With their own kind of logic and process. And I think that that process of validating our findings, going back to the community, was incredibly valuable. So I don't want to take too much time because I know we're going to have a plenary discussion, so I'll stop there.
Great, thanks so much, Hassam. I'm going to move on to Dr. Jakey and ask the same question. Please, introduce yourself and tell us about the Anticipation Alert project that you were involved with.
Okay, good morning, everyone. I'm Dr. Jakey Rodriguez. I'm the medical coordinator of Medicines Dumont. I'm joining you all from Manila, Philippines. So what we did with the START network back in April was to come up with an anticipatory alert intervention that responds to the flooding and the typhoon that happened in December 2021. So last December 2021, the Philippines was ravaged by a Category 5 typhoon, which devastated and cut across around 6 to 7 regions. So basically, the whole of archipelagos of Visayas and Mindanao were affected, and the aid that was brought was not uniform, and so the consortium of START network, we decided to focus on areas where there was less assistance, and of course the damages were huge. There were floods, there were landslides, there were a lot of shelters, facilities, housing that were destroyed. But what we wanted to focus on was to prevent the outbreak of diseases. So we all know that when a disaster happens, health facilities are overwhelmed, and a lot of them are also affected. The health personnel themselves are affected. The people do not have access to water, to other sanitation facilities. So we formulated a plan to try to prevent some of these waterborne and arthropod-borne diseases from happening. So Philippines is one of the top hotspots for dengue, and we know that after typhoon, there is more or less an outbreak of dengue that happens in certain communities. So with our partners, Relief International and Humanitarian and Inclusion, we went to the communities, to 2 municipalities that were also affected by the typhoon, and we tried to work in several levels of intervention. So we went to the community first of all to look at individual and household interventions. Our role as Medicines Dumont, which is the health organization, we focused on supporting health facilities, and we also did advocacy and policy work with local authorities. So focusing on our result, which is the result 2, what we did with community was in consultation with the health workers. We were able to distribute medicines and medical supplies that would help the community for dengue outbreaks, but not only dengue, but also for waterborne diseases and for influenza-like diseases. We also distributed dengue testing kits, and we did a lot of IACs with the community. So we involved the barangay health workers, which are volunteers of the community, to mobilize them, capacitate them, and train them so that they can go to the community and spread messages about preventing and knowing the first signs of dengue. As well, we also supplied sanitation supplies to different health facilities. So I think what we saw with this anticipation alert is we were trying to work on preventing an outbreak before it actually happens. So what we usually do in emergency response is we go with the medicines already, but here we were able to involve the community. We were able also to involve the volunteers on the ground and ask what their needs are. So we were able to give them the capacity building that they needed. And when we did the monitoring with delegates from the START network, we saw that the community appreciated it very much. It was not just a response to the initial crisis that they already experienced, but it was also a preparation for them for future crisis, and helping them to see how to prevent actually other events from happening, and letting them see that they have the capacity to do that. So I think that's a short summary of what we did in the Philippines for this anticipatory alert.
Great, thanks so much, Dr.
Thank
Shaky.
you.
So I'll move next to Uttam, and great to hear about your work.
Thanks, Ed. Good morning, everyone, and namaste from Nepal. I am Uttam Poil. I work in CRS Nepal as a technical advisor for disaster risk reduction, climate change adaptation, and emergency response. And this is where we had the opportunity to work with the START network, as well as like put in our own resources responding to this landslide and debris flow, anticipatory actions towards that. So can we go to the next slide, Ed? Yeah, this is like, if you recall, like the 2015 earthquake, this area in picture is very close to that epicenter in Gorkha. So the land slopes, the slope masses were very unstable, and likely to fail. And this year, like, unfortunately, it was monsoons in Nepal start from June and last until September. But the forecast from the Department of Hydrology and Meteorology in Nepal, as well as UK Met Office, where that this year the monsoons would be like heavy, like meaning more rains are expected, and then like it will last longer. So we saw the only like second week in October. So like on the very start, towards the like initial initial weeks of monsoon, we had a big landslides and debris flow in this area close to the epicenter. So around 28 families were affected. So we, like CIS, was present in the area. So we coordinated with the government, with the START network, with other NGOs and INGOs on how to respond, and what the response should be. Not the response, meaning like the landslide and the debris at that point had affected a small group of communities, while the community at large was around 168 families. So the risks were large that this landslide could be making its route to the bigger settlement and causing larger damages. So the anticipation alert was triggered by a small scale landslides and debris flow, but the anticipation was like, since more months of monsoon is there to come, more rains are forecasted already, we should respond to make sure that these communities who are at high risk are relocated to safer areas. So this response, this anticipatory action was towards these 28 families who were affected and at high risk. We have provided them shelter solutions primarily to move them away from the currently high risk areas to areas which were relatively safer, and provided them shelter solutions but that could help them undertake the multiple hazards that are exposed to that areas. If you could quickly go to the next slide, please. Yes, so yes, this one, please. Thank you. Yes, so the picture on the left is like when we started the anticipation actions. So there were some houses that were damaged, but the road, the channelization of the debris flow was very easily going towards the community that were settled there in large numbers. So from the day that we started coordinating, bringing together this anticipatory actions, the picture on the right is like the same bridge when there were more mud flows, more debris flows through those settlements which we had already safely moved to a safer place. So this is before and after, an evidence of how anticipation was more or less accurate, and then how we managed to save number of lives and properties there. Can you go quickly to the next slide, please, Ed? Yes, in this anticipatory action, as I was talking, it was largely focused on shelter, providing shelter solutions to these people who were at high risk. We took an owner-driven approach from our learnings since the 2015 earthquake, but also made sure that the shelter solutions were in safer areas. In addition to that, like I was talking earlier about 168 communities or families that were at high risk in the same earlier area. So like we also provided solutions for detailed geotechnical assessments, like on what the risks are, like is that landslide debris or channelization going towards that, like the larger community? Are the tension cracks already seen in the slopes gonna fail this year or next year? What could be the large scale interventions? So we coordinated with the like START members, START network in Nepal, with the government at the local level, at the national level, on like how this could be supported. So what we are seeing here is like these 28 families, through our support, through these anticipatory actions, are relocated. At the same time, the 168 families that are living there still, like the plans are being developed on like how to make sure that those families continue to live in those areas, how the risks are minimized, and so that like the people can thrive in those areas, in the same areas. So yes, that is the anticipatory actions that we did, focused on housing and like the risk reduction. Ed, over to you. Yeah, and then it was only possible through the support from the government, CRS, START network, and then our implementing partner, but largely the communities who came in to voice their concerns, voice their needs and preferences. So we were able to design this and implement this in this monsoon. Thanks.
Brilliant. Thank you so much, Utum. I'm going to stop sharing now so that we can open it up and have a panel discussion. Panelists, audience, think about any questions you have for the panelists, any comments you have. But I might kick us off with one more question. We've heard there about the anticipation alerts, and particularly around the analysis that you did to raise alerts and the actions taken to mitigate impacts. And there was a bit there around what the wider impacts are. So, you know, capacity strengthening, awareness around risk-informed action, working with and coordinating with partners. But I guess the question I'd like to ask is, yeah, is there anything you can expand on in terms of what the wider impacts of the anticipatory action you've taken in your context? How does it relate to the kind of disaster management landscape that you work in your context? And you know, what's the policy around anticipation, and how does it relate to the work you're doing? If that's not enough questions, then we'll have more in a minute. But perhaps Utum, do you have anything to expand on in terms of the wider impact of the work that you're involved with, Sudan?
So thanks, Ed. Hello again. So yes, so wider impacts. Basically, what I saw is like when we went into anticipatory actions, like communicating like why these are important, why these are timely, communicating the science behind the forecast, communicating like what is to come was a challenge initially. But like in our case, since the initial triggers, small scale like disasters were already underway, people were on the receiving end, so they had the more appetite to like listen to our suggestions, recommendations on why this anticipation alert was possible. But the same at the national level, at the local level was a challenge. But like this was a thing to be done, so we coordinated on those, and then like luckily, like we were able to bring the stakeholders together. Going forward, the similar was the case in like how this has the like wider impact within the agency or the stakeholders, like in the community as well. Like the voices were the same, like on like the timeliness of the anticipatory actions, on like what demands an action, a preemptive action for along those forecasts was always a concern. And then like in some cases, like we rightly are learning right now, we were late because like we were like trying to identify when to act. So like bringing together all those learnings, I would say the wider impact of like what CIS was able to do through these coordinations and then these actions was like as an agency as well, was trying to invest in those areas which would allow us to make those decisions early. In this case, like we invested in identify like in experts going out to the field, getting us the relevant information, what the risks are, a primary like scoping study kind of tasks. But like going forward, we thought that those enable us to do these actions and then like talk about these lives and like properties saved, right? So going forward, we are as an agency, we're trying to make sure that those investments are in line whenever these cyclic nature of disasters are to occur. So I think those are positive changes that we can carry forward. And as a learning platform that that the Start Network allows, I think these learnings are already shared and will also be shared to allow more replications, I would say. Thank you.
That's really great. And yeah, that report that you mentioned, if anyone wants to read it, then where can they find it?
So yes, this was shared to the START platform in Nepal, in the START Secretariat in Nepal. But like this is a public document since we are acting on those recommendations. So initial study that allowed us to make those judgments go into action is already shared. I can say it with Ed again, or like put it in the chat here. But like what I was saying earlier, like based on those initial, like because like we're only moving or supporting directly the 28 households. There are more households that communicate that they feel still that they are at risk. So we are already conducting a detailed study to make sure that risk is quantified, as well as like based on those, the recommendations are communicated to the other stakeholders that can carry it beyond, right? So yes, like the study that was already shared, I can say it again, but the study that is ongoing, I'll say it once completed.
Great, thank you. Hassan, same question. Wider impacts. What have you been what have you seen in terms of the work around anticipation?
So I think if I'm going to talk about wider impacts, I'll probably split it into three pieces. The first is an internal one, right? Within Save the Children as an organization, not just within Sudan, but within the wider organization, we're seeing more and more appetite for anticipatory action. I don't want to put this all on the AA work in Sudan. There's plenty of great AA work being done across the board. But now there's an appetite for basically riskier AA work, where there's appetite for both scaling up the proven pilots and then as well as doing riskier and riskier pilots in a kind of no regrets approach to AA, right? So that's definitely something we're seeing within the organization. Within the wider APES sector in Sudan, we're also seeing increased coordination for AA work. We're now talking about starting an anticipatory action technical working group to design trigger models for floods. We're seeing other organizations reach out to us looking to share their experience. We're seeing more and more AA pilots happen. More AA pilots have happened this year. I expect that we're going to see many more pilots in the coming year as well. And so there's definitely been a movement there's definitely been an understanding within the community in Sudan that that AA works and that there is a space and opportunity to do so. And then finally, at the community level, the AA work was particularly transformative in a couple of communities. Our teams there on the ground have built excellent relationships with these communities, and now they are proactive. They will reach out to us and say, look, thank you for what you did, but we see opportunities to mitigate these risks here, to mitigate these risks there. We got some internal funding this year, and while we weren't able to go back to all of the communities that we worked with, there were a couple of communities that were again re-identified as being high risk. And so we were able to integrate their plans into the AA actions that we are doing this year. And that open line of communication that's happening, the shift in how, you go to any community and they'll tell you should act before the crisis, but there's a shift now in their understanding of how to leverage these things. It's particularly valuable working with, the community committees, community disaster risk reduction committees, who are embedded in different social structures. So in one place it was under a youth council, in another was under a traditional council. But the fact that they now feel like they can set plans and then reach out to aid agencies for help, particularly on AA, is very heartening to see, I think.
Definitely. Thank you, Hassan. And Dr. Jakey, I know there's lots of, or there's a strong history of anticipatory action in the Philippines. What do you see as the wider impact of the work you've been involved in?
I think I would say for as a health organization, it changed, or it reframed the way we think about a health crisis. When you respond to a health emergency, it's always you come and you try to save as many lives as possible when the crisis is already there. But with this anticipatory alert, we try to look at the different stages of prevention. So in health, we have primary prevention, when we really try to come up with measures to prevent the event from happening. We can work on a secondary prevention where we detect the problem early, and we can, if it happens, because sometimes inevitably a crisis will happen, such as a dengue outbreak, we can still do some work on tertiary prevention, which is minimizing the ill effects of this event. So I think this anticipatory alert allowed us to look at an intervention for dengue outbreak as a continuum, as not just as a response, but also from prevention to the curative side. And to echo what the other two panelists mentioned, because it was done prior to a crisis, you have a community who are not in the stage where they are still devastated. Some of them have recovered partially, and therefore you can coordinate more actively with them. They are able to contribute. They are able to be engaged in all the activities. And I think when we went to the community and actually not just ask them what they want, but involve them also in planning, in the activities, it gave a sense of empowerment to them. And after experiencing a heavy disaster such as this Category 5 typhoon, what we really heard from them was they began to have hope again. So you just need a little push from outside, but then because of partnerships with them, they are able to realize their own capacities and plan forward. I think that also is an impact that we had with this anticipatory alert, because we were able to work actually in different levels of intervention. So from the higher provincial officials, municipal officials, health authorities, and to the community, everyone was involved in coming up with the best plan for the community to move forward.
Great, thank you for your answer. We're now going to move to audience questions. But beforehand, I just, if the panelists, if you have questions for each other, feel free to throw them in as well. Particularly if there was something which sparked an idea or similarity between your work. But first, I am going to go to a question from Matthias. So, unfortunately, I'm going to read this out rather than have you ask it yourself, Matthias, just because it's easier that way. But so, a question for the panelists. In retrospect, did the risk materialize as you anticipated? Did you feel you had the right balance between the lead time before the crisis and the forecast skill of the decision to raise the alert? And in the case of where you had kind of a longer lead time, might it be possible in future for this allow for different type of anticipatory action? So there's a few questions in there. Does anyone want to take that one? Does that spark a thought in any of you?
Yes, like I was saying in the slides, there was one picture. So what I was trying to communicate was like, yes, we put some effort into using the forecast to set our actions in anticipation of the bigger one. But like not captured in the picture is that the landslide or debris flow that we anticipated could have swept the whole community. It did not happen, luckily. But like along the same principles of do no harm, like we are making sure, like we are happy that we could contribute, like at least like a few households, like a few lives could have lost. So these impacts, these losses don't have a value to it. So I think like even if the scale of disaster anticipated was not fully realized, we in our case were able to have some level of those risks materialize, and the actions input put into place, we're able to save some of those like anticipated losses, I would say. So yes and no at the same time, but it was a good exercise. We learned a few things for the next time to be better prepared.
Maybe I can jump in here as well. For us, specifically on the AA action on flooding, I mean, the risks materialized, but it's difficult to gauge. And this is one of the challenges with AA work. It's difficult to gauge how bad the flooding would have been without the AA work, because a lot of the work was meant to basically mitigate the effects of flooding. And so the only real way to assess success is to assess it with previous years. There's also been cases where the risk did not materialize, but not as bad as we expected. There was one case where it was actually beyond what we expected. There was, I don't want to go into the details of it, but there was some human error outside of the aid agency system that caused the flooding to be worse in that area. I will say that the focus should not be on getting on whether or not the risk materializes, right? Even if the risk doesn't materialize, ideally our work should be building resilience to these communities. We should be taking AA work as part of the continuum. I saw there was another question about VRR here, but disaster risk reduction, AA work, early action, response, early recovery, it should all be part of a continuum, because many of these risks are recurring annually. They are occurring nested within other chronic crises. I don't think there is an AA project that is diminished by the fact that the risk isn't materialized. I think we should be planning our AA work so that if the risk doesn't materialize, these communities' resilience is built. If it does, then at least we are mitigating the amount of harm there.
Great, thank you. Go ahead.
I would also like to add that I think that question, it was actually the great debate for us. How do you measure something that is not supposed to happen? And if it does or if it doesn't, how much of your work can you attribute to it happening or not happening? So it's going to be a very difficult question to answer, because we know that in each context, in many cases, we are not the only actors. We are not the only ones working. The government is working, the community is working by themselves. There are also other NGOs and INGOs on the ground. So even saying that it is only our action that will prevent the risk from materializing, it will be very difficult to go into that conclusion. But also, as mentioned a while ago, what we heard from the communities, there are little wins that you get. There is some reports of behavioral change, some reports of improved health-seeking behavior, some reports of increase in people receiving aid, and I think those indicators that we aim for, they have been tested, they have been evidence-based, and we already know that even if the risk comes or not, we try hard to make sure that whatever the consequences are minimized for the population. That's all.
Great, thank you, each of you. And just to say on the DRR question, just to plug a session later in the assembly. It's one of the in-person sessions. There is one on this question of anticipatory action and disaster risk reduction. So look out for that if you are attending in person. So I'm going to move to another which is from Bonn. So it's around what are the key roles each actor, specifically those concerned with local government units and affected communities, if there are community-based structures and organizations, local NGOs. So question is, who decides the kind of action and the activation, and are these part of local government plans in your context? Does anyone want to start us off with an answer for that?
Maybe I'll go first, although perhaps I'm the person who's going to be least useful on this question. The political landscape in Sudan is and has been very, very complex. Obviously, we do work closely with government, whether that's national, state level, or local level, but there's also, community structures that have existed for a very long time. Any work we do, irrespective, must be done in coordination. But it's been very useful to get buy-in from existing community structures. And again, those differ from community to communities, right? I use the word community. The community might be 3 or 4 villages that have a single local administration, or it might be a single village with a council of elders or a youth group that is leading. It's about identifying who the actors are at the local level, right? The ones who have the most influence, the most interest, and trying to work with them. But in terms of government, at this point, we're just dealing with the bureaucracy and trying to work around it. So perhaps Sudan is not the best example of how to coordinate with government on AA.
I'll take a second. So on this, I was seeing, like, when we are implementing response versus anticipatory actions, since the anticipatory actions allows lead time for us to program, like plan and then like implement, also the community to make sure that they can contribute to these like mitigative actions so that their losses are minimized. So I could see like the anticipatory actions allowing the community to put like their resources also to support these actions from our side. So that was a very good part on that. But like on the coordination, yes, the local government is local government, meaning the local government are municipalities in Nepal. So we have a multi-tier government, as is like likewise in many parts of the world. So the local government have the responsibility of providing to the communities. They have also a budget in line of 10 to 15% of their development budget. But like in anticipatory actions, the things get very political, because like the disaster has not realized. We are anticipating that there is a higher risk, but the government at all levels say that if we go about like supporting with anticipatory actions, they could be like on the principles of do no harm as well. It could be either like deciding on like this area or that area could get very tricky and political very soon. So they kind of stay away from that. But more and more, like they are willing to like review the evidence-based advocacy for anticipatory actions, as we did in our side, as Hassam has been doing in his side, maybe all us are doing on our sides. But like going forward, the government is also saying that they are willing to support these initiatives, these anticipatory actions that we are piloting in a larger scale, and like to make sure that these are systemic across the government tiers. The government is also investing through our support, like investing in working groups to bring together the ideas, what anticipatory actions are, like why should these areas should be prioritized over the other areas. So things are moving. But like there is a reluctancy from the government sides despite our coordination, but like in some cases they are willing based on the evidence. If not, like they say like it is very political to act along those lines and then like stay away for a response at a later period.
Yes, for us, because it was a health intervention that we did, we made sure that all the programs are anchored to existing health programs by the government. And this is because we are not going to stay there forever. And whatever we start, we wanted to make sure that the health authorities can finish or can continue. And at the end of it, what we want is people to be able to access healthcare. And we are not providing healthcare. It is the government who provides free healthcare. So we had to make sure that whatever we were doing, was the same as what the government intended. Even our IEC materials, we adapted from what the government had. Even our trainings, we tried to ask for what the government modules had, so that whatever we gave to the community that we helped, it was the same as what was being received by other volunteers, other community workers all over the country.
Great. Thank you, everyone. Unfortunately, we've run out of time. Lots of other questions. I see there's a few around money and donors. Check out the report soon to be published by Start Network about financing for anticipatory action, and join the sessions on Start Ready, which is the latest innovation in anticipatory financing from Start Network. I want to thank each of the panelists so much for your contributions. Sam, Dr. Jakey, Uttam, but also all of you who've put some really good contributions. I hope people have been able to read all the questions and comments, because we weren't able to get to all of them. But really rich discussion. There will be a recording of this session shared, so you can watch it back. Yeah, get in contact with Anticipation at startprograms.org.uk if you are interested more in anticipation and raising alerts, or want to follow up on anything. And final thing to say, the next session is in 15 minutes, is stories from local innovators creating sustainable locally led change. So hopefully you will be able to enjoy that session as well, and the rest of the assembly. So thank you again, everyone, and I'll end the session now.